Our first series welcomes topic experts using the ISPA 8 investments to frame the conversation, showcasing Scotland's whole systems approach through a long-term health condition lens.
Hello and welcome to today's podcast, Movement in Conversations. I'm Emma Anderson from Movement for Health, and I am joined by Daniel and Clara today to talk about active travel. This is our first series of Movement in Conversations, and we are focusing on the Physical Activity for Health framework, 8 investments, 8 themes. And under each theme, we have guests coming to talk about it with us to help us explore Scotland's activity in that area. So I have Daniel Bulawa from People and Place Policy Delivery Manager, Sustainable and Active Travel Unit at Transport Scotland. Managed to get that out in one go just. And then Clara Walker, the Executive Director at FEL. Good afternoon to you both, and thank you for joining us.
Good afternoon.
Hi, Emma. Thanks for having me.
So active travel is the theme of our conversation today. Global Advocacy for Physical Activities, GAPA, reported that active travel is seen as the most practical and sustainable way to increase physical activity on a daily basis. So active travel is so important to see more people supported to move more in different ways. And I'd just like us to start our chat today by exploring what active travel means and what that looks like on a Scottish landscape. So Daniel, I wonder if you would kindly kick us off with active travel in Scotland from Transport Scotland's point of view.
So travel, so in a nutshell, top line is it's walking, wheeling and cycling. My academic background many years ago was in philosophy, and so I could quite enjoy getting stuck into the endless ways you can break that down, and a pogo stick is an active travel, a unicycle, and all kinds of, you can get into really interesting areas around kind of powered mobility, wheeled mobility and stuff like that. But yeah, in some ways it's very simple thing to define, and in other ways, when you start to look at it, it breaks down in really complicated ways. There's a paper I quite like that summarized it as movement in which the physical exertion of the traveller contributes towards their locomotion or something like that. But yeah, it's walking, wheeling and cycling. And in terms of Transport Scotland and our active travel framework, it's walking, wheeling and cycling for short everyday journeys. And sometimes we talk about miles, sometimes we talk about kilometres, but it's a certain number of walking and a certain slightly longer number for cycling. And again, that breaks down in lots of really interesting ways. You start to talk about what's a functional journey, what's a leisure journey. But, in a kind of common sense way, it's you're every day getting about doing it by walking, cycling, wheeling, which is using a wheel mobility aid like a wheelchair, that kind of things. A simple question that unpacks in lots of really interesting ways and complex ways and contested ways. For the purposes of sort of the part of government I work in, it's walking, wheeling and cycling for your short everyday journeys in a nutshell.
Yeah, and it's, as I understand it, it's that trying to get away from taking the car for some of these shorter journeys and things. And
that's the real prize. Yeah, those kind of replaceable, the shiftable journeys. Yeah.
And what about on a national level then? What is being done within the active travel sphere, Daniel?
So you can break it down into terms of sort of the unit I work in. We have the Sustainable Active Travel Unit. We've got 3 main strands, but we now also encompass sustainable travel as well as its own strand. But essentially, we've got active travel infrastructure and we have active travel behaviour change. Your infrastructure is your obvious stuff. It's your cycle lanes and the path building, footway maintenance and upgrading, that kind of stuff, the real hard measures. And then the side of the team that I work on is active travel behaviour change. So that's about trying to create a culture of active travel, and that really there's an entire galaxy of interventions and projects that falls under that umbrella. Everything from teaching children to ride bikes, to led walks and rides, maps and apps and challenges and campaigns, cycle maintenance, skills classes, confidence building. Really, it's a huge amount of different kind of work going on across the across Scotland. So we work on sort of how you support all that work to happen in kind of ways that you can try and get a handle on what the impact is and make sure what's happening, the right stuff is happening in the right places where it needs to be happening, and helping people make that shift in their habits, and that we bit by bit build a culture of active travel. We kind of get that population level shift in attitudes and behaviours and habits.
And when we look at the transport hierarchy, first of all, we have walking, obviously, at the top, that being the most accessible for the most people in terms of active travel. So how important is walking in the work that you're doing, Daniel?
As you say, it's right at the top of the sustainable travel hierarchy, or sustainable transport hierarchy, whichever phrase you want to use. So it's of the highest importance. I would say on paper, there's a caveat there, because it can be a hard thing to target and measure and get a handle on. It's too often taken for granted, overlooked perhaps, some might argue. But on paper, in theory, looking at all our strategies, our aims, our goals, as you say, constantly highlighted as the wonder drug in population health terms, something we can, most of us, do most easily at pretty much zero cost, shoes and a jacket, and you can go out to walk. It's a big priority.
Thank you, Daniel. Now, Clara, if I could bring you in here to talk about what else is happening. So we've heard from Daniel there around sort of a highlight, just a snapshot of that national picture. At a local level, or a more local level, can you talk to us about the work of FEL and what it is you're doing in this space around active travel?
Yeah. I think it's a nice combination having Daniel and I here, Emma, I think, because, it's great to hear Daniel talk about the kind of the bigger picture. And I suppose I feel what we do is put that policy into practice at a local level. As an organisation, we're an environmental organisation, so our kind of what we try and do is deliver kind of solutions to climate change, of which active travel is one at a local level. And we do it in three ways, trying to meet people where they are. And I know that's an oversaid statement, but break it into really bite-sized chunks of, if we look at active travel and what we do, we have 3 steps to kind of achieving awareness into action. So step 1 is just raising awareness of cycling, walking, wheeling, scooting, skateboarding, again, responding to what people want within their own communities. The next step that we take is about creating access for people to participate. So, and that can be helping them understand how they can use the paths and networks that are around them. But it can also fundamentally be giving them access to bikes or equipment or trailers or helmets, locks, anything that will actually meaningfully enable people to get on a bike or to get on a scooter or try skateboarding. And then the third part of that is that we want whatever kind of project or awareness raising activity, we want that to remain within the community. So we want to embed the skills. So the third part is the skills and capacity building. So to make sure that communities and people, they know how to fix a bike, they know how to keep their bikes going, they know where to go. It's just about making sure that we kind of close that loop. It's almost like a very local system of support. So 3 steps: raise awareness of active travel. Step 2 is provide access to the equipment, facilities that enable people to take part. And step 3 is give people and communities the skills and the confidence to keep it going.
Now, you said confidence there. Obviously, with the Movement for Health work, we're looking at these 8 themes through a long-term health conditions lens. We heard at our most recent meeting from Dr. Graham Barker at the Physical Activity for Health Research Centre at the University of Edinburgh. Together, we asked them to do some mapping around programmes that promote active travel to people with long-term health conditions in Scotland, to sort of understand if that was a focus when these programmes are being designed and implemented, if that was a a focused population for these programs to reach. And through that exercise, he also did some work around understanding barriers, specifically to people living with long-term health conditions, and confidence and fear and anxiety, perhaps not unsurprisingly, came up quite a lot as barriers there. So I'm wondering, Clara, what does that look like in your programs in terms of this sort of helping people to overcome some of those challenges? What do these programs consist of for people that are joining them?
Okay, so we kind of take, again, a few different models. So we've been developing our active travel work probably for about 10 or 12 years at FEL. And over that time, we've tried lots of different mechanisms of engaging people, lots of different locations, town centres, transport interchanges, primary care, GP practices, hospitals. And over the past 5 years, I think what we've settled on as something that we feel works is using the secondary school within a community as the anchor. So the secondary school is a focal point for the community. It's fed by the cluster primary schools within that community. You also then have community anchor organisations who are trusted, respected within that community, and you have employers. So it's that localised system of support. So we've developed active travel hubs in secondary schools, embedding our officers within the school and building that confidence up through transition programmes through the primary schools, and where we see traditionally cycling rates, drop substantially when young people go into secondary school, looking at how we can tackle that. So having a range of activities. So we've developed 12 curriculum linked activities that we can deliver with the school community over our time there, over the academic year. And that ranges from like taster sessions, bikes, scooters, skateboards, walk leadership that we do in partnership with Paths for All, Emma. We deliver a Healthy Minds programme, which was designed post-COVID, which was really to kind of help young people disconnect a little bit from their mobile devices and give them some time out of the classroom, connecting to nature, but doing a little bit of walking, wheeling, cycling, route planning, foraging, cooking, all of the different things that just connect people into where they live. So all of these little steps are kind of part of a kind of programmatic journey about building young people's confidence and their parents and carers. And we've been really fortunate over the past 4 years to be delivering Scottish Government's Free Bikes for Young People, Access to Bikes programme. And that's been transformative, to the communities that we work with and to the young people who have received a bike through that programme. Over 1,000 bikes have been distributed to date. Another 500 will go out this year. And it's that for the young people, giving them that sense of independence and the confidence of knowing how to use their bike and where to go with it, knowing how to fix it. We do the SQA bike maintenance within the school, and I have a lovely story about that, which hopefully I'll come back to later. But and then at a wider family community level, it's about kind of understanding what those needs are with parents and carers. And a lot of it is just simply having access to the equipment that they can take part in an activity. And we work very closely with our local partners to enable that, either through our own bike library or working with local partner organisations that will help do that. So that's in summary.
Yeah.
We have a health programme as well, Emma, that we have been working with NHS Forth Valley for about 8 years now, very much with a preventative approach to healthcare. We started off with a bowel cancer pilot. It was just before COVID, working on a pre-habilitation and a rehabilitation programme around giving patients who had been diagnosed with bowel cancer long-term access to an e-bike. That has progressed through the kind of work with the team in NHS Forth Valley to rheumatology patients and mental health patients who are receiving support. And again, these programmes are just around building a little bit of a network and a peer-to-peer relationship between people, and just working with them to build their confidence in how they can use an e-bike for their own health. But obviously we want that to translate into long-term daily use.
Excellent, lovely examples there, Clara. Thank you. And very much that supported community focus, which I know will resonate across lots of different types of programs in this sphere. So thank you. That's a lovely example. Daniel, I wondered if I could pick up the infrastructure side of things with yourself, because from that research I mentioned with Edinburgh University, infrastructure barriers were also a primary reason why people living with conditions found it difficult to make those active travel choices. And that's a variety. We had people with safety concerns, we had people with personal, like physical concerns for themselves, so people obviously living with chronic conditions, chronic pain, also chronic fatigue, respiratory issues, not feeling safe and able, that sort of anxiety and fear side of things. But then on the infrastructure side, just not having, either not knowing how to get around actively, and things that were available to them not being accessible for them as individuals. So I wonder what work is going on in this area to support more people that would need more considerations to be actively travelling.
I mean, we're doing work to increase the scale and pace of active travel infrastructure delivery. There's been a big transformation program over the last couple of years to institute a new kind of tiered delivery model. It's based on more of the kind of project management being done in-house by Transport Scotland, and more money, I think, being given to local authorities. So that's sort of not my area of expertise in terms of the nuts and bolts of how that's all working, but it all jigsaws closely together. So I know one of the conditions, for example, one of the things that we look for, that my infrastructure colleagues look for when they are looking at their kind of tier 2 applications from the local authorities or national park authorities or regional transport partnerships, is there associated behaviour change activity going on planned around that new infrastructure. So that's an attempt to start to pull these things closer together, and it's something that's part of the benefits of the kind of transformation we've been through on the behaviour change side of things as well, with the creation of this new People in Place programme, where we put the budget into the hands of the regional transport partnerships, who are partnerships of local authorities. So it's now the people who are building the infrastructure and the people who are planning and commissioning the delivery of the behaviour change interventions that sit around it. Those levers of power now in the same hands, or hands that are more closely working together. Regional transport partnerships, for example, are statutory members of community planning partnerships. So the idea is that we start to tie the commissioning, the design and commissioning of our behaviour change interventions more closely to community needs that are found out through engagement with the community. So there's work kind of on a structural level to bring these things closer together. One of the big complaints is often in transport is around disjointed decision making. So we're working our way through structural reforms of the kind of the delivery model to that. And then in terms of, and then there's things like, well, as you say, sometimes it's not the infrastructure itself, it's knowing about the infrastructure, and that's where the kind of the behaviour change things can plug in.
I quite like some examples from the Ian Finlay Path Fund. I'm thinking from a pastoral perspective, something that lots of us really, really enjoy is hearing those community stories from community projects that have benefited from the expertise of the Ian Finlay Path Fund, but it's been such a community initiative with huge opportunities to engage along the way, and the engagement is happening with the people that essentially will benefit from that infrastructure change, rather than the people that are already able to get from A to B and things. It's really bringing in more voices, and the voices that need to be heard. And I think that's really special. I did give a different example on another podcast when we were talking about places and spaces with Irene Buteman and Dr. Callum Lees of our dementia-friendly environments work at Paths for All, and that local level support. So you had planning, you had roads, you had community members, you had people living with dementia, you had carers of people living with dementia, talking about their experiences of actually physically using that space, because only they really could identify that actually that we need to have a crossing there, because this isn't, it's too far away, or that corner's too fast, or there isn't something, an island in the middle of the road would be of real benefit for X, Y, and Z. And before those conversations could take place, that hadn't been, on the minds of the planners and things when putting that in place. But not only, what I really liked about that example was once that infrastructure change happened, the people that lived in that space that were living with dementia benefited from those changes, but actually loads of other people in that community benefited from it as well. Even though it was a dementia framed project, actually it was benefited everyone, people with mobility issues, parents, buggies, anyone with slightly slower pace, people with visual impairments, that, it really helped across the community. And so I just would love to see all these sort of planning of infrastructures and program planning happening with that real end user involvement from the start. Just a couple of nice examples there from the Paths for All projects that I'm aware of.
Living Streets do great work as well. I think their pavement audits, going out with groups of volunteers to map pavements, curbs too high, this is cracked, this is, and then when you start to see it mapped out, and it's these little inconveniences that add up and just make the increase the friction of stepping out your door and getting from place to place. And it's maybe only until you start to, one drop curb is easy to ignore if it happens to be, it's impossible to ignore if it's going to stops you in the way, but if you're otherwise ignoring it, but then when you start to see these audited and added up and you see them on a map, you think this is a massive problem. Drop curbs and pavement quality is a really frustrating kind of example, because each individual thing on its own is tiny and it's but it adds up and it's just it's the number one complaint around accessibility of our walking infrastructure. So yeah, that's certainly an example of good work as well.
Yeah, and I see a lot at the moment online of from wheelchair users who film their journeys to show that actually they have to go onto the road at certain points because of inaccessible, safe or uneven pavements and potholes and obstructions and things. And actually seeing it through their eyes via video, I've found so powerful to really open up that experience to me as a non-wheelchair user. Clara, did you mention that you look at the infrastructure as well within FEL?
So, I mean, we very much sort of, are focused on the behaviour change side of things. But inevitably, we look at infrastructure in terms of how people are using it, encouraging people to use it. But just through the very nature of the work that we do, we start to understand, where the gaps are. It's also naturally people will take the route of least resistance when they are moving between communities. And as part of and it's been by accident rather than design, but we've got a kind of an e-bike library that's available for the communities that we operate. Well, it's available for anybody within Forth Valley region, but predominantly for the communities where we've got active travel hubs in the schools. And all of the bikes have got kind of trackers in them that just from a security point of view. But what that does do is it helps us understand how people are using the infrastructure, where they're going and what routes they're taking. And it's kind of that information that becomes quite gold dust for our local authority partners when they're trying to identify, how people are moving, how much of the infrastructure that, the paths that are there, the networks there, how are they being used. So I think, and what is lovely about what we can do is that communities and the way people move between communities is fairly porous. They don't look at the barriers between this is Stirling or Clacks or Edinburgh, or they just want convenience. They want it to be easy for them and to be accessible and consistent. And I think community organisations like FEL and like others across Scotland who are doing similar work, we just have that very kind of localised understanding and knowledge of what people want. And, I think going back to the examples, and I love this. And again, so much of the really kind of great things that happen at behaviour change at community level happen by accident rather than design. One of our rural secondary schools, the young people who have gone through their bike maintenance qualifications said to their teacher and our kind of colleague working there that they would like to set up a bike maintenance shop for their community. Because they're rural, there is no bike maintenance shop within a local area. For people to get their bikes fixed, they have to go, the nearest town is kind of like 15 miles away, 20 miles away. And so 3 weeks ago, the kids set up Balfron Bike Shop in the school, and they have fixed 7 bikes from the community. They've got 21 bikes booked in. The money that they're generating through the bike shop is going back into the school. And just for these young people, it's again that kind of entrepreneurship is one, but they're providing a service for their community. And it's a lovely example. And it's kind of things like that where you think, actually, that is something that we can replicate in other areas, not just in Forth Valley where FEL works, but across Scotland. These young people, you know, we've got one of the young boys who is now independently really doing all of the kind of maintenance checks and changing gears and the technical speak that obviously I don't have. But I think it's things like that put Daniel and the Transport Scotland policy into practice when you can see what a really meaningful impact that it can have. And again, it comes back to that closing that local loop. And I suppose the best way is, I know we use all of these different forms of language, but it is building community wealth, you know, at a local level. And it's seeing and demonstrating more of these, because I think that's what resonates with people, because they can see how they can apply it, you know, in their day-to-day life.
Absolutely. I love that, like the secondary benefits of these programs are vast. There's so much potential. I hear so much going on, really good stuff out of Balfron at the moment. It's lovely to hear another example of Balfron. That brings me on to data. So data kind of popped up into my head there, Clara, whilst you were giving us that example. And something, Dan, you were saying that obviously walking can be trickier to potentially measure or track. How are we collecting data? And I'm just thinking about if our audiences are thinking or involved with programs already, or thinking about how they could be involved in programs. What are the data collections that are going on at the moment that people can participate in, and what needs to be thought about when setting these things up?
That's a tough question.
Either of you can answer.
I'm really interested in, Clara, you were saying that the data from your bike hire, from your bike library, I'm really fascinated about how that's being collected and used, because we've got the cycling open data portal, and then there's data protection issues and all that kind of stuff. So that I'm really interested in how that works, but maybe that's for another offline discussion, as they say.
No, I think it is. I'd love to. And what we would really like, we've been trying to work with the university to look at kind of mapping of that, and we have gone through all of the data protection kind of considerations with it in terms of this, the how we manage that in terms of our bike library, as all the bikes have their own names, which are all Scottish Islands. But I'd love to talk to you about it. And I suppose I'll give you a practical example. You know, while Daniel's thinking about the kind of the bigger picture data collection, collecting data on active and sustainable travel is really, it's difficult. And, you know, I think, again, it's trying to find a mechanism where you've got the greatest chance of capturing people very quickly to give a snapshot of where they're at. So we do it as part of, in the school community anyway, we do it as part of school assemblies. So we do assemblies with the whole school at the start of the academic year and then at the end of the academic year. As sort of a quick snapshot of where are you, what do you want to do, you know, what would you like to get out of our work. So this year we got about 2,500, 3,000 responses during assemblies, and we do a QR code, and it's a quick, do it when you're in assembly. It's the quickest way to get the young people to kind of and at that time, our member of staff is there talking to them about what we do. They make a direct connection between the kind of, I suppose, cause and effect person and what they want to get out of it. So this will be the first year, the first academic year that we'll have done the before and the June after. So I'd be quite keen to see what happens and what we learn from that. But I wouldn't say any of us have got the data gathering correct.
You haven't solved all those problems. Haven't solved it.
We are continually trying to look at innovative ways that we can just understand how people are feeling. The best way that we can look at it is actually using our eyes and find out we've got people within the community. Are they seeing more people engaged with walking, cycling, wheeling? Are the routes being used? Are we seeing people? And then obviously we've got the kind of metrics of how many of our bikes are being out on loan, and I can categorically say right now we have none. One came on at the weekend, I was reliably told by my colleague, and 4 people tried to get it. So that is an indication of the weather changing and people want to get back out on 2 wheels again. So there are kind of simple metrics, but I think we also use the case studies and the softer stories about that actually tell you the real impact that active travel can have on an individual or a family. I think, what I think we need to get better at doing, and I think some of the things on the podcast, the series, the episodes that I've seen earlier, Emma, it's that that the preventative work that we do. For us, a lot of the young people who are engaging at a secondary school level are maybe struggling with school attendance, they're struggling with mainstream education. But if through getting them engaged in skateboarding or scooting or out on a bike, if that gets them to come into school, that also means that we've got a better chance of working with the school to keep them in school. That also then has a knock-on impact on their family situation. It might enable their parents or carers to go out and work while they're at school. And it's all of these softer is the wrong word, but it's the kind of the wider ripple effect that you can't just capture in
isolation. You're absolutely right. And that's kind of covered some of what we discussed in the Active Systems podcast with Chris Topping and Dumfries and Galloway. And some of it I questioned with Chris actually in that episode about, could some of this be happening and we just don't know, or we don't necessarily report that we actively travel somewhere, for example. So, for example, I don't know if I have ever been asked about how I get around. We're a non-car family. We made that decision for various reasons, and I walk everywhere, or I use public transport, or we use the City Car Club because we can. But I don't think I've ever told anyone that. And I'm just wondering when we're looking at the statistics of who is actively traveling and how people are actively traveling, just like with other episodes on the podcast, I did wonder, well, maybe more people are actively traveling, but they don't necessarily think about it. It's perhaps part of their subconscious in that, well, of course I just walk here, or there isn't somewhere for them to report that, if that makes sense. Daniel, am I making any sense with that in terms of like tracking of travel?
Because, in terms of our national sources of data, we've got the Scottish Household Survey, we've got the Walking and Cycling Index, there's the city-based one, there's the Hands Up Survey, Scotland. We do have some big set-piece kind of national coverage sources of data. And so the challenge is, so we can see those numbers. We have an established and growing set of modal counters. Sometimes they just count bike, sometimes they count walking and cycling. The technology is evolving in terms of what they count, how they count. You have the kind of the statistical department for transport based kind of vehicle counts, but that's kind of, it doesn't count individual roads very well. It's kind of very much a network based estimate of vehicle movements, and again it's based on vehicles, it's not capturing or active travel. There's a whole landscape of kind of these sources of data. So obviously we track those. And then we also have all of these, as we say, a whole galaxy of literally thousands of individual interventions. Understanding how each of those has changed someone's travel behavior. It might be over 6 months, which is a challenge. It's very resource intensive. It's prone to evaluating, is quite specialist, quite delicate, really. There's lots of influence and bias that can come in when you're asking people questions and you're trying to extract kind of robust findings from what you've done. Plus behavior change happens over years, not months. You could do longitudinal studies, well, we can come back in 3 years, 5 years, 10 years, how people actually traveling. So that's what we're trying to, that's the kind of the landscape we're working in. What we're doing with the People in Place program at the moment, as a kind of a nationwide funding mechanism that gives this funding to the regional transport partnerships and local authorities, is to try and get them to use a common set of survey questions for kind of pre and post intervention surveying of people who are taking part in the various interventions, to try and give us a bit of a uniform baseline measure of attitudes, behaviours, feelings that's linked to the outcomes indicators in the national active travel framework. Now, that's not perfect by any means, because there's no one size fits all way of doing this. It's kind of like our best starter for 10 at how to do this. And it's got all kinds of challenges there, like I say, the capacity to do it, the kind of information bottlenecks as you pass this information up the chain, and what insights can we draw from it, So we're very much in a kind of test and learn and evolve phase of trying to work out how to pull together all the information we have.
Mhm.
And that's kind of why I'm really interested in all these conversations about data and data platforms. So that's one way of doing it. But as you say again, Clara, that doesn't capture everything either. Yeah, you need the human impact. You can't boil everything down to metrics.
No.
Although our North Star as a transport agency in terms of climate, 20% car use reduction, is about modal shift, and that helps us sift through all these myriad of fantastic co-benefits to try and not be siloed, but to retain a bit of focus on something. Ultimately we can tell ministers, yes, this taxpayers' money you're investing is shifting us towards the transformative change that you've asked us to do, which is to make walk, wheeling and cycling the most popular choice for short everyday journeys by 2030, and to reduce car use by a certain percentage by a certain time. We have to be able to demonstrate to government and parliament that we're kind of progressing towards that through what we're doing, and we've got health, and everything plugs into that.
I would say, to give you a sense of confidence, Daniel, we use the framework in our QR codes in our assemblies with kids. And what's been really, from a practical delivery point of view for an organisation that works across different regional transport partnerships, that consistency of having a kind of set of standardised metrics makes our job a lot easier. We I suppose welcome is that flexibility to adapt that a little bit in terms of how we make that accessible to the different groups that we're working with. And I think if we can get a mechanism where people just feel comfortable and it gives us a sense of what's happening and how they're feeling. But yeah, I think I fully support that sort of consistent approach. But I always have that concern that we're not quite capturing all of the ripple effect that some of our project work. But I think wouldn't matter what you were doing. I don't think it would matter what sector. I think it's the same challenge that we would face.
You're right. It's quantitative and qualitative, and that experiential stuff that needs to be included so much in consideration as well. When I was at a conference last year out in Paris at the ISPA Congress, which was incredibly informative, week over there, just really inspiring. One of the keynote speakers was from Google, and they were talking at length about wearables and the role of wearables in the future of understanding people's activity. So I just know that there's so much more to come in that space for us in the not in the near future, and it's happening now, but much more to come. Obviously GDPR and sensitive data and safety concerns and everything else that goes along with that. It's quite complex. I like to finish off. I feel like we've just gotten started. We could talk for another few hours about active travel. And I love, Daniel, let's think about longitudinal podcasting, and we could come back in 3 years, 5 years, 10 years to see how people are actively traveling then. I wondered about Clara, did you want an opportunity to share a story with us? You were touching on a story earlier from, was it a young school person, or was that the Bikeability, the Balfron?
The Balfron bike shop.
Excellent.
So I think just that was the most recent, which filled my heart with joy.
Quite right. Quite right.
But yeah, So, I mean, I have others in terms of just the kind of the direct impact of certainly the Access to Bikes programme from the P7 transition into secondary school. Of just, I think, one that I ended up talking to Granny of Young Man 3 times. She just wanted to phone and say what a difference it had made for her grandson, who she looked after, who was school refuser, and having access to the bike and bike maintenance and the route planning as part of his primary transition into secondary. He's been up and out of the house every morning since he got the bike. Wow. So again, it's these stories that I suppose, Daniel, I mean, you know this as well, but when we're speaking to our local decision makers and politicians, when you can really put a personal kind of touch and see the direct benefit that some of these interventions that actually, when you look at numbers and you look at pound signs, you know, it's very hard to see what the meaningful impact is. But I think that's where working with kind of local partners like ourselves and others, we can translate that kind of as the policy into practice.
Lovely. Thank you both so much. I wondered if for this series we've been asking our guests to just share a little bit about their own movement for health at the end of our conversation. So this is just what is your movement for health and for yourself personally, and what does that mean to you on a daily basis? You know, we're talking about active travel today, and how to put that more into people's daily lives. And I'm just going to put that back to both of you and just like to hear how you like to move and what inspires you to move. Daniel, I'm going to pick on you first, if I may.
So similar to you, Emma, I go everywhere on my bike or on the bus or walking. I take my little one to and from nursery every day on the bike seat. I recently upgraded my bike. It's quite an old bike. Put an e-bike motor on it, kind of converted it into e-bike. Helps me get up the hills because I do everything on that bike. You know, I've got a trailer I used for the weekly shop. I took the Christmas tree home on it this year in the bike trailer. So yeah, I do everything on my bike or on the bus, or if we need I don't drive. Like I've always lived in cities, and driving's always just been slightly financially out of reach. Just the cost of lessons is so expensive, and then just the thought of buying a car, where to keep it, how would I use it? You know, partly just geographically where I've happened to live, and I've been lucky enough to sort of have jobs where I could get to or work from home, something like that. So partly just circumstance, but partly just because of me. But yeah, it's just in active travel and public transport. It's just embedded into sort of how I live, just by accident, I suppose. That's just the way it turned out for me. But I really enjoy it. I did have a little gap in not cycling for a long time, and then getting back on the bike was massively uplifting. I was, I missed this, you know, the freedom, the wind in your hair, you know. So it's like, getting on a bike is a lot of fun, apart from anything else. Very fun way to get about.
I concur. And as an adult returning to cycling after what I imagine most people, the statistics are that you stop cycling after sort of childhood, and then I returned, and actually I did what was Fourth Environment Link, adults returning to cycling course in Stirling. You'll be delighted to know, Clara, and I loved it. Absolutely loved it, and would recommend it for all adults that need a bit more confidence, just a reminder of what you're doing, and you know, getting back on that horse or bike, as it were. Clara, what about you and your movement for health?
So I am very much kind of in the middle of everything. So I rely on a car. I live rurally, and and the public transport connections are not fantastic where I live. But in terms of so I'm probably, what is it we call a multimodal person.
Yep.
So but in terms of what I do personally, I walk. I have a very exuberant and quite bonkers dog. So and she's completely blind. So we have our interesting walks that we do locally. And I think I also, as a woman getting into her mid-years, I am now discovering the benefits of yoga to improve my flexibility. So I have a minimum of 5 minutes of yoga before I go to bed at night to try and increase my flexibility. And I am a huge advocate of bikes, especially e-bikes. I feel e-bikes have given me the confidence to be able to cycle a bit more, particularly with my family, who are much more bikey orientated and able to get up hills that I perhaps wouldn't be able to. I just a little bit of everything.
A little bit of everything.
Yeah.
Excellent. Well, thank you both. Thank you both so much for your time today on such a big topic as well. I think that this one, as well as some of the other ones, it's a
huge.
meaty topic to try and unpick. And maybe we'll come back and try and take a deep dive into some of those bits of the topic at another stage. But thank you to Daniel, thank you to Clara, and thank you to our listeners today. I hope you've enjoyed it. If you have, please tune into the other episodes in this series of the Movement for Health podcast, Movement in Conversations. Thank you for listening, and bye-bye for now.